15 past hour this morning, President Trump will head to Walter Reed Hospital for his annual physical. At 78, he is the oldest person ever sworn into office, and his checkup could be the first official update on his health since the assassination attempt last July. Joining us now, NBC News White House correspondent Yamiche Alcindor and NBC News medical contributor Dr. Vin Gupta. So, Yamiche, do we have any idea of what kind of health information might be released or when we'll see details?
Well, it's a key question. We know that the president has said that he would release reports about his health. And back in December, he told Kristen Welker during her interview with him that he was feeling good, that his reports were doing good and looking strong. We also have a post that he made on Monday. I want to put it up for folks. He said, "I am pleased to report that my long-scheduled annual physical examination will be done at Walter Reed Army Medical Center on Friday this week. I have never felt better, but nevertheless, these things must be done." So that was the president saying that he's feeling great. Of course, as you noted, he did survive that first assassination attempt, and there was a wound to his ear where we had that bandage for several weeks, but that seems to have healed. He also, of course, had COVID back in 2020. At one point, sources told me that he did get very, very sick from COVID, but he was able to recover. He was able to, of course, run for office again, is now in his second term. So it's a question of when we will know about this physical, but we know that at some point, the president has promised to release this report. There has been some controversy because the president's last doctor in the first term was saying that he's the healthiest person he's ever examined. We'll see if we get that again today, Jose.
And Dr. Gupta, what specific health indicators would doctors be focused on for a 78-year-old patient?
Well, you know, Jose, at 78, routine screenings like colonoscopies, PSAs for men tend to be on an individual basis. We say, you know, generally, maybe after 76, let's think about this on an individual risk-based basis, family history, all those things. And so it's to say that this is going to look specific to President Trump's family history, how he's overall doing. Things I would keep in mind, just to build on what Yamiche said. Neurologically, you know, we talk so much during the election cycle about cognitive impairment, cognitive dysfunction. I think if we're speaking honestly, issues of recall and memory, I've seen a lot of, as you have as well, President Trump's speeches during the election season and ever since, he has had some issues with memory and recall and forgetting things. And so will they do a formal cognitive assessment? This became sort of the buzzword, obviously, over the last year. I think it's important. I think it's important for every president, a sitting president, to have that type of assessment and to be very transparent to the American people on what that looks like without editorializing. So will that be done, number one? Number two, you know, there's been, just in researching his past physical exam reports and what's out there, you know, his height has been under question. Is it 6'3"? Is it 6'1"? That matters because BMI, you know, whether or not he's cardiovascularly at risk is dependent on your weight and your height. And some people, BMI is an imperfect metric when you think about cardiovascular risk, but he is sort of on the verge of obesity. He's on a cholesterol medication, we know, rosuvastatin. What does his cardiovascular health look like? What does his BMI look like? Is he making progress in that, in staying as healthy as possible? Again, he's 78, he's the president. We worry about things like high blood pressure, cholesterol levels, and overall being overweight, which he has a history of.
And so, Yamiche, who decides how rigorous these tests are carried out, how rigorous they are? And then how much does a president have in what doctors check or don't check?
It's a great question. I know that the president has said that he's going to be open and transparent. I would imagine if the president's going to the doctor, it's maybe possibly like many of our doctors, in that if they see something that is alarming, they're going to check it. They're going to make sure that the president's doing okay. We know that the president has been out golfing a lot, and there's been some questions about, at one point there was a sort of bruise on his hand and there were close-ups, and we did some reporting on that. So maybe the president will get that checked out. But I think this is really in the hands of the doctors mostly. Of course, though, there's a lot of questions about whether or not President Trump will release a report if there was some big issue with him, Jose.
And that's a question that I guess one must have asked presidents in the past as well, and sometimes those answers were not forthcoming. But Yamiche Alcindor and Dr. Vin Gupta, thank you both so very much. Turning now to the investigation